I'm joined now by Dr. Matthew Tichauer from the Emergency Medicine Department at Hartford Hospital. Thank you for being with us.
Thank you.
Before the pandemic, you had already developed a special critical care program to combat the rise in critically ill patients. So how is that now being mobilized?
Well, about 5 years ago, after coming to Hartford Healthcare from Boston, there was already a need given the increased critical care burden on emergency departments across the United States. Over that period of time, we developed curriculums to train both physicians, nurses, as well as respiratory therapists to create a cohesive group to address these critically ill patients, particularly given the ongoing need and demand for critical care. During this pandemic, we've opened up a emergency intensive care unit, which prior we actually had a team that had already addressed critically ill patients solely in the emergency department. This allowed us now to not only address them within the ED, but also manage these patients in the emergency critical care unit, ED-ICU, at Hartford Hospital.
And now tell us about this specialized COVID airway response team.
So there was a ongoing concern after reviewing reports out of Europe and New York in the epicenter, obviously putting healthcare workers at risk from aerosol generating procedures. These are most notably intubation. So as physicians, we are leaning over the patient and intubating the patient, and they're breathing on us, and that exposes us. So my thought and our division decided to team with the Department of Anesthesia and create a COVID airway response team in which we, with the support of the ED leadership as well as the administration, were able to obtain the best possible protective resources. And now for all intubations, we have respirators that we can use, particularly emergent intubations that we're doing that require seconds response time. Those that can offer more time, particularly on the floor in the ICUs, the anesthesia team addresses those.
Are you seeing a rise in patients as we hear the peak is yet to come here in Connecticut? We're approaching it.
It seems as though the ongoing patient population is pretty steady with respect to COVID patients. I have a unique perspective. I work both in the intensive care unit and in the emergency department. In the intensive care unit, the issue with these patients is they're remaining intubated for long periods of time. Every new patient is adding to those that are already there. So with respect to new patients, it seems as though we have a steady plateau of patients, but in the ICU, the numbers continue to increase on the floors and in the ICU.
Doctor, thank you so much for sharing your time with us.
Thank you very much for having me.